Good afternoon, everybody. Thank you for gathering for our first budget hearing of the Public Safety and Administration Subcommittee for the 2024 legislative session. For the record, I am Chair Delegate Jazz Lewis, and we are here today with a full agenda to discuss a number of agencies and issues facing our state government. I want to start off by thanking you all for your service to our state and the people we all serve. Today we're going to be looking at the Maryland Emergency Medical Systems Operation Fund, or MEMSOF, and the issues surrounding its long-term sustainability and fiscal health as it meets its responsibility to respond to Marylanders in crisis. I know it's a top priority for Chair Barnes and Speaker Jones and all of us here in the legislature that we come up with solutions that will allow us to meet our obligations to Marylanders facing emergencies. So I want to thank all of those from MEMSOF who are joining us today. We are also joined today by the Office of the State Prosecutor, which is instrumental in holding officials accountable, including us here. I know that despite being a smaller agency, it works on some of the most high-profile and important criminal cases and investigations. We are also to hear from our wonderful Secretary of State, Susan Lee, who I've worked a lot with her and her staff when they were in the legislature, on a wide-ranging amount of work, which is important both here in Maryland and across the globe. Lastly, we're going to be joined by the Department of Public Safety and Correctional Services Secretary Carolyn Struggs, who will be able to touch on the ongoing work throughout this vital agency. I know I share my subcommittee's dedication and intention to the ongoing work and challenges the department faces as we work to maintain an effective criminal justice system with accountability and rehabilitation at its center. I know there are a lot of topics to dive into, which our wonderful analysts from DLS will be able to walk us through. I know of particular concern for the subcommittee is the ongoing challenges within the Department of Corrections' high vacancy and turnover rates, which is not new, and they are working hard at, especially among our correctional officers. I know a number of us would also like to get an update on the ongoing work to fulfill the years-old mandate as relates to the Women's Pre-Release Center, and we were all glad to see that that was added to the governor's budget. And last but not least, the ongoing RFP for the new healthcare provider for our state's prisons and jails. I would like to thank all of today's printers and our analysts for the work that you're doing, and I'll now turn it over to our budget analyst, Madeline Miller, for her presentation. Thank you.
Good afternoon, and thank you, Chair Lewis. My name is Madeline Miller, and today I'll be presenting the DLS forecast of the Maryland Emergency Medical System Operations Fund, also known as the MEMSOF. The MEMSOF is funded mostly by a biennial surcharge of $29 on motor vehicle registrations and is used to support key components of the emergency medical services system. As shown in Exhibit 1 on page 3, funding supports the Maryland State Police Aviation Command, the Maryland Institute for Emergency Medical Services Systems, the AMIS Fund, the Maryland Fire and Rescue Institute, and the Shock Trauma Center Operating Subsidy. On page 4, Exhibit 2 shows MEMSOF expenditures from fiscal 23 to 25. The 2023 spending for MS-PAC is approximately $200,000 lower than it appears in the budget books. The Department of State Police reports that the difference will be resolved in fiscal 2024 closeout. Now moving to the current year and the allowance. Total MEMSOF expenditure increases by 1.2%. Most of the growth is attributable to employee compensation enhancements and higher maintenance and repair costs for state helicopters. The decrease of $5 million for the R. Adams Cowley Shock Trauma Center reflects the removal of a one-time $5 million grant provided in fiscal 2024. Because the working appropriation and allowance do not recognize adjustments for salary enhancements that are currently budgeted within the Department of Budget and Management, personnel expenses may increase expenditures for the Maryland Fire and Rescue Institute, MIMS, and MS-PAC. Exhibit 3 on page 6 shows the MEMSOF revenues and expenditures from fiscal 2014 through 2023. The MVA registration fee was last increased in fiscal 2014 when funding from moving violation surcharges were also applied as a new revenue source. Those changes resulted in a surplus to the fund in fiscal 2014 through 2017. That accumulation of funds was then used in years where expenditures exceeded revenues. Between fiscal 2022 and 2023, revenues increased by 18.4% in response to a 1% increase in registration fee revenue and a $10 million general fund cash infusion. In those years, DBM also transferred $900,000 and $3.5 million in general funds for salary enhancements. Expenditures have also risen since fiscal 2014, outpacing revenues in fiscal 2018 through 2022. MEMSOF expenditures were reduced in fiscal 22 and 23 because helicopter maintenance and replacement radios for MSPAC were instead provided with general funds. Even though revenues have improved compared to fiscal 2020, as shown in Exhibit 4 on page 7, the registration fee revenues has averaged $71.2 million since its peak. Traditional revenue streams for the fund are not expected to return to or surpass their pre-pandemic levels in fiscal 2024. The positive ending balance in fiscal 2024 is instead the result of general fund support to the fund. The issues section of this forecast begins on page 8 with a table that describes the different assumptions made by DBM and DLS when estimating revenue and expenditure. On page 9, Exhibit 6 provides the DLS MEMSOF forecast, and for comparison purposes, Appendix 3 provides the DBM forecast. While both DLS and DBM forecast deficits beginning in fiscal 2026, DLS expects larger deficits each year. The most significant difference between the forecasts relates to the growth rate calculation. Because DLS uses a longer time period, rates tend to be higher. While this explains the difference in rates seen for MIFRE and MIMS, there's another difference related to MSPAC. The DBM forecast does not include the portion of helicopter maintenance funds that would have been supported with special funds if additional general funds were not used instead. The demands to the special fund are not entirely captured through the actual figures and through DBM's estimation. Both forecasts may understate growth for MIFRE, MIMS, and MSPAC related to fiscal 24 and 25 salary enhancements. DBM reports that the fiscal 2024 statewide salary allocation for subrecipients is $432,199. DBM is not yet able to provide the fiscal 2025 figure or share if the 80-20 fund split will be applied for MSPAC. Exhibit 7 on page 11 shows that temporarily reduced expenditures and the influx of $35.5 million between fiscal 23 and 24 extended the fund's solvency. Costs exceed revenue in fiscal 25 and beyond. DLS forecasts that the fund will require approximately $18.8 million in additional general fund support in fiscal 26, and that increases to $38.9 million by fiscal 2030. While there were significant resources available in the general fund in recent years, cash infusions are less viable in fiscal 25 and the out years as general fund deficits are forecast for fiscal 26 and beyond. Sustained general fund support erodes the linkage between the biennial surcharge and the costs of the EMS system. The administration and the EMS board should comment on how they intend to improve the fund's health, particularly for fiscal 26 and beyond. And to keep pace with rising costs, the General Assembly should consider fee increases or other revenue enhancements to sustain current levels of MEMSOF-supported operations. This would require the enactment of separate legislation no later than the 2025 session for any changes to be implemented prior to fiscal 2026. I'd be happy to take any questions at this time.
Thank you, Madeline. Members, do you have any questions for Madeline at this time? Seeing none, thank you so much. And now we will invite up representatives from MIMSOS to opine and give us some feedback. Thank you, and make sure for the record state your name and title.
Good afternoon, Mr. Committee Chair and members of the committee. My name is Clay Stamp. I'm the chairman of the Maryland EMS Board. It's an honor to be able to be here today, and I certainly appreciate on behalf of the EMS Board your willingness to help keep the EMS system alive and well in the state of Maryland. Thank you to Madeline for your report, and the numbers speak for themselves, and I have my colleagues here who will speak a little bit to the numbers. I wanted to take just a minute, Mr. Chairman and members of the committee, to talk about our Maryland EMS system. This year is our 50th year. It all started 50 years ago, post-Vietnam, where a lot of ideas came back to Maryland, and that's when we saw Dr. R. Adams Calley, who wanted to set up a trauma system and an aviation program. The U.S. Department of Transportation allocated funds to jurisdictions to be able to treat victims of crashes better. And then something really exciting happened in 1993, and it was this body, the General Assembly, that formalized the EMS system in Maryland and set up a structure, a framework of collaboration to build out what we see today. And that's a ground-up solution. So there's 5 regions around the state where there are regional councils, and those regional councils have representation from EMS, volunteer fire service, general government, public health, a cross-section of community. And that bubbles up to a statewide advisory council that's appointed by the governor. This is all legislation that you all created. There are 31 members of that advisory body called the State EMS Advisory Board. And it's everything from anesthesiologists to emergency physicians to nurses to helicopter pilots to fire EMS. And they all collaborate around issues. And that bubbles up to an 11-person EMS board that's supported by the governor. I'm honored to be the chair of that board. I started when I was 14 years old as a cadet in Ocean City and came up through the ranks. And somehow I ended up being the chairman of the board, so I'm very proud. It's the greatest story ever told in Maryland's history of saving lives. But we have a challenge now. Every day, this is how it plays out. Over 1 million calls a year are received in our 911 centers for a medical emergency. And that starts in action over 400 organizations and agencies around the state and thousands of people. It plays out in every bedroom, every living room, every establishment in the streets of Maryland where this system works, saving lives. But we've gotten to a place where we need your help. You know, we were getting ready for this testimony, and somebody recommended, you know, what you need to really do is say, what does this mean and why does it matter? So I spent a lot of time thinking about what does this mean and why does it matter? I've explained that we have a diverse system. And it's not just shock trauma. It's not just the helicopters. It is 24 911 centers. It's 24 jurisdictions. It's volunteer and career fire departments. The hospital emergency departments. It's a collective. And everybody puts into this system to make sure we get the right patient to the right place at the right time. And something that this body here did masterfully, was they put money on the table with the EMS board and the statewide advisory council. And when you put money on the board, the partners come to the table. They come to the table and they find real solutions to real problems. But again, we need your help now. And why it matters, I just thought about my career. And I remember, I started a long time ago. I started in the 1970s, but I remember a man named George Bender came up to me. I was probably only 30 years old. He was in cardiac arrest about 5 years before, and we got him back. Amazing, we got him back. And Mr. George Bender said to me, I just want to say something to you. You gave me 4 more years of life with my family. If it wasn't for you, I wouldn't have had the last 4 years of life with my family. I tell you that because oftentimes as policymakers who started on the ground floor, sometimes we forget. The votes that you make here gave George Bender 4 more years. And every day, these folks that sit behind me, that respond to these calls, they have people like that come up to them, real people that have been given more time. So what I'd say to you is, on behalf of them, thank you, committee. Thank you, legislature, for allowing us to have the resources we need to give somebody another year, 4 more years. And hopefully that answers the question, what does it mean and why does it matter? So thank you, from my heart, thank you. I'll turn it over to the Executive Director of MEMS.
Good afternoon, Mr. Chair, delegates of the committee. I'm Dr. Ted Delbridge. I'm the Executive Director of MEMS, the Maryland Institute for Emergency Medical Services Systems. And I realize that you have my written testimony, and so it's okay, I'll just highlight a few things. MEMS is the independent state agency that coordinates all components of the statewide EMS system, and we do so in part by promulgating statewide clinical protocols that are used by the clinicians in the field, by licensing and certifying EMS clinicians, maintaining and operating a statewide communication system, designating trauma and specialty centers, and mostly supporting the efforts of 28 jurisdictional EMS operational programs that actually deliver the state-of-the-art care. The MEMSOF provides the vast majority of MEMS operating budget for initiatives that benefit our entire statewide EMS system. We're, of course, grateful to the efforts of the General Assembly to ensure the ongoing viability of the fund that we're here to talk about. We're grateful to Madeline Miller for her comprehensive and thoughtful analysis, and also to Christina Jorge-Tunyan, our DBM budget analyst. In 1992, the General Assembly created the MSOF to ensure a solid financial foundation for the infrastructure of Maryland's EMS system. But the real fabric of the EMS system is nearly 20,000 men and women, EMS clinicians, emergency medical responders, emergency medical technicians, paramedics, and so on, who serve their communities. Last year, they responded to more than 1 million calls for help, and they conveyed more than 550,000 patients to hospital emergency departments for definitive care. In their treatment, they use the clinical protocols that are promulgated by MEMS to ensure that everybody in the state is entitled to the same level of clinical care. When they make choices of where to take patients, they choose among emergency departments, adult trauma centers, pediatric trauma centers, primary stroke centers, thrombectomy-capable stroke centers, cardiac interventional centers, perinatal referral centers, a hand trauma center, an eye specialty center, and 2 in-state burn centers, and MEMS designates those centers for their use and availability. Sometimes they need help making clinical decisions that are complex or getting guidance that is more advanced than clinical protocols provide. And those times they make contact with EMS base stations and talk to physicians, and they do that through the Emergency Medical Resource Center, which last year handled more than 200,000 calls from the field to link clinicians in the field with hospital resources they needed. It's headquartered in Baltimore with satellite operations in Allegheny and Talbot counties. And as a reminder, MEMS is in the midst of a multi-year project to upgrade the EMS communication system from analog to digital technology. I'd like to make sure the committee is aware that several months ago, we found significant construction deficiencies in a radio tower in Annapolis, in the Pearl area, at the Annapolis Armory, that requires significant reconstruction or fortification. And we're currently working with the Department of Budget and Management and the Department of General Services to identify the approximate $1 million in funding that'll take and achieve those funds without tapping into the MEMSOF. When they're done with their care, EMS clinicians record their encounter on a uniform electronic statewide documentation system that's managed by MEMS. It allows data from EMS encounters to be incorporated into patients' longitudinal healthcare records. It allows us to populate efforts such as community health surveillance efforts by MDH, to fund, to fortify research efforts, and to inform the work of other work groups that are functioning throughout the state to improve the trauma system and healthcare for all. And these are just a few examples of how the MEMSOF manifested into a leader among statewide EMS systems across the country and benefits every citizen in Maryland. We've paid close attention over the past few years as MEMSOF's looming insolvency has become more in focus, which has only been delayed by the substantial general fund infusions. We're grateful again to the General Assembly for those. We very much look forward to continuing to work with the Governor's Office and the legislator to ensure a robust future for a system that genuinely serves all Marylanders each and every day. Thanks.
Mr. Chairman, members of the committee, my name is Michael Cox. I'm here today in official capacity as the Executive Director of the Maryland Fire and Rescue Institute at the University of Maryland. The Maryland Fire and Rescue Institute is the state's comprehensive training and education system for emergency responders here in the state of Maryland. Every responder, whether they be from a volunteer fire company or from one of the career or combination departments around the state, is touched by MIFRE, as we call ourselves, and receives training from us. Typically, in any year, we train between 25 and 35,000 emergency responders in the state. That is both new training as well as recertification trainings. That just last year amounted to about 645,000 student hours across the state. It was about 1,600 classes that were delivered. The delivery locations for these training goes from Western Maryland down to the Eastern Shore and here in Central Maryland. We have 6 of our own full-fledged fire training academies here in the state, and we also utilize 12 of the municipal and county fire training academies statewide to deliver this training. As you heard Chairman Stanford EMS Board say, that we are part of this MSOF group. And I won't belabor many of my comments, but I would like to say in my official capacity at MIFRI, I do get to travel around the country. And traveling around the country, it is clear that Maryland has the best emergency medical services system that any of us responders have known. We're head and shoulders above all the others across this country. In fact, in many places, the only responders they have may be volunteers who are out there, but they're still a big component of our system. I'll leave you all with this thought. In the last few years, there's been 2 tragic incidents that have occurred up in Baltimore City where firefighters have lost their life. And because of our statewide EMS system and our statewide certification system for emergency responders, the Baltimore City Fire Department was able to be put out of service on the days of the services for those men and women who lost their lives. And that is key because of our EMS system and statewide certification system. There are ambulances and firefighters and EMTs and paramedics came from Deep Creek and far out in Western Maryland, down on the Eastern Shore and in the central area to put the entire Baltimore City Fire Department in service during those days. So I'd be happy to answer any questions that anyone would have at this time and appreciate your support that we've had over the years for this system.
Good afternoon, Mr. Chairman and members of the committee. My name is Eric Smothers. I'm the president of the Maryland State Firemen's Association. I represent over 25,000 volunteers, fire, rescue, and EMS personnel across the state out of 363 volunteer fire departments, which is about 80 to 85% of the fire service across the state of Maryland, from the Western Maryland to the Eastern Shore to Central Maryland. The funding mechanisms that you have put in place are second to none across the United States, as our members have already stated. When you travel out of state and go to other states, as I have had the opportunity over the last several years, people trying to figure out how Maryland does it. You know, what brings us so close together to provide a #1 fire, rescue, and EMS service across our state. And it's because of the partners that we have here that you have helped us build going forward and even in the past. I, too, am a long-time EMS provider, almost 40 years of service. I was fortunate enough to work with the Maryland State Police Aviation Command as a flight paramedic, recently retired after 37 years. I know the impact that this funding mechanism has, from its helicopters to the shock trauma system to our 911 system that we deliver every day. It is also crucial for us as volunteers, as volunteerism is slowly dwindling across the state, to be able to provide apparatus to some of our struggling volunteer departments. Some of those departments are on the brink of collapse, if not already about to close, because of those struggling issues with trying to get volunteers within the fire service to continue to provide the services that we do. And that certainly impacts the amount or the vehicles that we put on the street. A lot of the departments volunteer, do their own independent fundraising. When you look at apparatus, an ambulance 5 years ago was about $250,000. Now it's about $500,000 for a long ladder truck that you see riding up and down the street. 10 years ago, 5 years ago, that vehicle was about $1.2 million. Now it's about $2.2 to $2.5 million. That we try to raise additional funding for in order to maintain that same level of expertise. With the training and the funding mechanisms that you have put in place through MSOF, we're able to continue to have Maryland be a leader, not only here in the state, but also across the country, provide the adequate resources that we need to get our people from the 911 call to the right place, to the right time, the right facility, without a whole lot of guesswork. A lot of other states struggle to do that. They don't have the built-in infrastructure. They don't have the partnerships that we have. And that, again, brings us all to the table to iron out our differences, to maintain our adequate training levels from our fire, rescue, and EMS personnel across the state. So for that, I thank you for your time.
To all of you, thank you, one, for your service to our state and the work that you do coordinating the care for our citizens that we love. I will hold my questions to after our members in case they have any. Does anyone have any questions for the panel? Right. Delegate McComas.
And sir, there are two more of us.
Oh, there's two more that are testifying?
Yes.
Okay. Well, before we bring them up, are there any questions for the ones who are currently here?
Well, I just, I happened to run into someone who probably all of you know, Jimmy Malone. He was on the floor the other day. And he's going to be, I think, coming up from time to time to talk about the concerns. But he said that, that the building materials have changed significantly over the years. And now with the using glue, sometimes when they go into these places where there's a fire, they're real concerned that the fire really gets going a lot quicker in time than in when the building construction was different. And I was wondering if you have, obviously you guys know, you have different groups, but are you able to kind of coordinate with the building industry to sort of make sure that they're not using glue or putting HVAC on roofs that can collapse on the firemen? And I mean, there's just kind of a real concern when they go into a roaring fire now because they don't know what to expect from the way the building's constructed. And I know it's a little off key, but I just wondered if there's coordination.
Michael Cox from MIFRI. And yes, ma'am, there's a coordination between them. Sometimes we bring people in from the building industry to help provide seminars or education to the firefighters here in the state. There's not much we can do outside of codes and standards that are passed about the lightweight construction, but it's been around long enough now. We all have an awareness to it, and our tactics as we go to those types of incidents change, and that's what our firefighters and EMS personnel are being taught here now.
No worries. Any further for this panel? All right, thank you. We can add up the next two who are going to come up. Yeah. And Mr. Chairman, don't get too far. I might have a question for you just once they're done.
Good afternoon. My name is Major Michael Tagliaferri. I'm the commander of the Maryland State Police Aviation Command. I would like to formally thank Madeline Miller for her comprehensive analysis, as well as the committee members for their support you've provided to our department and our partners seated before you here today. The Maryland State Police Aviation Command is extremely proud to be the public safety organization, the leading public safety organization and essential statewide aviation services to the citizens of Maryland for the past 53 years. The department has submitted written testimony which provides some background information on our program and mission statistics for the past year. In regard to the request for comment on page 3, Ms. Miller did advise that our reconciliation will be completed in fiscal year 24 closeout. The Aviation Command, along with its partners, acknowledges the forecasted insolvency of MEMSOFT and is committed to working with our partners, the legislature, and the governor's office to find a long-term solution to the insolvency of MEMSOFT. Our medically oriented mission, which includes the airborne delivery of emergency medical services, search and rescue, aerial extraction of injured patients, is a critical piece of Maryland's EMS and trauma system. Without continued funding of MEMSOFT, our program and the programs of our partners will no longer be able to be be able to provide essential EMS services to the citizens of Maryland. In 2023, Aviation Command personnel safely flew nearly 2,000 patients to area trauma centers for care. Just last month, our EMS system was put to the ultimate test at the scene of a complex motor vehicle crash on Interstate 83 in Parkton, Maryland. Just after 7 a.m., fire department personnel and EMS ground providers responded for an injured patient who ran off the roadway in a box truck and collided head-on with a tree. The subject was trapped in the vehicle in critical condition with traumatic injuries. Fire and EMS ground providers, trained and certified through programs and protocols established by MIMS and MIFRE, utilizing apparatus funded in part by MEMSOFT, work to free and treat the patient. Due to the severity of the patient's injuries, ground providers made a call to the Emergency Medical Resource Center, staffed by MIMS personnel, and the SYSCOM Helicopter Communication Center to request a helicopter to airlift the patient to a trauma center for life-saving care. While fire and EMS personnel worked to extricate the patient, Trooper 1's helicopter, based out of Martin State Airport, launched and headed to the scene to prepare for a medevac. Simultaneously, Trooper 2 from Joint Base Andrews flew to the University of Maryland Shock Trauma Center to pick up the GO team, which is staffed with a trauma surgeon and a nurse anesthetist, to be flown to the scene to provide an even higher level of care. While the fire department personnel continue to work on extrication, Trooper 1's crew of paramedics, now on scene, administered 2 units of whole blood to the patient while still trapped. The trooper medics, in coordination with the GO team who arrived on scene, provided patient care and stabilizing medication throughout the 2.5-hour extraction process. Once extricated, the patient was flown by Trooper 1 with the GO team to shock trauma for further life-saving care. This call exemplifies the incredible teamwork by fire, EMS, MIMS, shock trauma, and the Aviation Command to effect a positive outcome for this patient. Without sustained funding of MSOF, patients like this would never have made it to a trauma center in time to save their lives. Thank you for the opportunity to speak before you today. Our partners at Shock Trauma, represented by Dr. Christy Snedeker, are also here today to discuss their role of patient care in Maryland's EMS system. Thank you.
Sure. Good afternoon, Mr. Chairman and members of the committee. My name is Dr. Christy Snedeker. I'm the Vice President of the R. Adams Cowley Shock Trauma Center inside the University of Maryland Medical Center. You have my written testimony, and I'm just going to pull out a couple of points that I want to share with you today. MSOF has been the cornerstone of this state's capability to provide every citizen a broad and uncompromised safety net. As established by state law, the R. Adams Cowley Shock Trauma Center is one of the core elements of the state's emergency medical services system and serves as the primary adult resource center for the state of Maryland. No other distinction of any other trauma hospital has the PARC as its level of designation. And with that designation, we are set up to provide care 24 hours a day, 7 days a week, with a designated and dedicated trauma resuscitation unit, trauma nurses that respond to that emergency level of care upon arrival, trauma surgeons, trauma ORs, and trauma nurse anesthetists. With those designations, that puts us in a unique situation for financial requirements for our standby costs to be at the ready for every patient that crosses our threshold. We are extremely grateful for last year's one-time $5 million grant that was provided to supplement the shock trauma standby costs, as well as the $9.5 million that was allocated to support the Maryland trauma system, of which the Shock Trauma Center was earmarked for $1.2 million. With these additional funds, that helped to narrow the gap in fiscal year 24, but didn't cover all of our standby costs. We're extremely grateful, and Madeline, thank you for your report that the Shock Trauma Center is earmarked for $3.7 million through the MSOF for fiscal year 25, which is 4% of the total revenue of the MSOF fund. It's important to note that when MSOF was established in 1992, the Shock Trauma Center received 10% of that revenue. If we were to receive 10% of that revenue this year, we would get $9.4 million. Our standby costs for fiscal year 25 are $9.7 million, and so it would certainly help us narrow the gap. In addition to those standby costs, we face unfunded requirements through our designation as being the primary adult resource center for the state of Maryland. Annual expenditures include supporting emergency medical services research and education to our partners that you heard today, outreach for our statewide prevention programs, and training within the hospital to ensure that everyone is at the ready for those patients. And lastly, the GO team. The GO team is on standby as well. And as you heard Major Tagliaferri say, they were deployed to that patient on 83. And after that patient arrived with us, they stayed for over 20 days, sustaining lung injury, soft tissue injury, orthopedic injury. But I'm happy to report that with all of those efforts, that patient was able to discharge home with their family. That's pretty tremendous. Home after 20 days with us. Home after 2.5 hours being stuck in a box truck. Receiving 2 units of whole blood at the side of the road. Since then, that patient has come back to us in our outpatient clinic and is doing extremely well from a functional standpoint. That's what this fund secures for every citizen of the state of Maryland. And we thank you for your support. We need your support. This needs to continue for the next 50 years. Thank you so much.
Thank you, Major, and thank you, Doctor. I think on that point, I'm going to ask the chairman to join you guys. You can stay there. Because one of the questions that I know my colleagues have, and I'm going to go out and ask it, is on the sustainability of the fund, which Madeline topped on. I just want you guys to opine on strategies or ideas. I see some stuff that was written, but just for the record, if you guys could opine for those who may be watching online.
So, first of all, the board took a look at the regular requests of our partner agencies, and we found them to be in order, in line with mission, not out of the question, and therefore we support the mission, and we have done that. We have had conversations about it, appealing to the legislature to put a bill in to increase the registration fee. We also understand that there are challenges with the registration fee and its performance, but certainly that is probably the preferred action that we're looking for, some assistance with the vehicle registration fee, the current funding methodology. So again, that's where we are right now. We also recognize that there are additional efforts underway to look at the system, to fund certain things, and we remain available to have conversations with the committee or what have you, if to come up with some ideas.
Thank you. Members, any questions? Delegate Spiegel.
Thank you, Mr. Chairman, and thanks to all of you for the great life-saving work that you do every day. A few of you referenced in the example that the Major talked about, and in other instances, the use of treatment with whole blood at the scene of catastrophic incidents. And as I understand it, it's a relatively new program for the Aviation Command, I think since 2023 or so, to carry whole blood in the helicopters. And I wonder if you could just comment a little bit more about that particular program, the whole blood program, and how the mobile whole blood program and its use, how that piece operates relative to overall funding with MEMSOF, and whether there are other funding sources that are used for that particular piece. Thank you.
Thank you. Yes, the Maryland State Police, in coordination with our partners at the University of Maryland Shock Trauma and the Blood Bank, started this program in May of 2023. It was a combined effort in order to get the protocol set in place, established a series of policies and procedures to utilize the whole blood. The Maryland State Police is currently carrying 2 units of whole blood on each aircraft, 7 sections throughout the state. The cost of the program is minimal. In 2023, I believe we spent approximately $45,000 in order to get the program up and running. It's a program where we are recycling the blood, so no blood is being used past expiration. Once the expiration date is approaching, if the blood is not used, it is then transferred back to the Maryland Trauma System, and it's reincorporated back into the program. So it's a minimal cost program. A lot of effort went to get it up and running, but now that it's up and running, it's saved countless lives. I believe in 2023, we've used approximately 68 units of blood and transfused that into patients in Maryland.
Thank you. Any further questions for the panel? Seeing none, thank you guys so much. We look forward to staying in communication. All right. Next, we are going to move to the Secretary of State's office. And I ask for Micah to join us for the DLS analysis.
Good afternoon. Thank you, Chairman, and the citizens of the great state of Maryland for allowing me to speak before you today. My name is Micah Richards, and I am presenting the Secretary of State Budget Analysis. Starting on page 1, the Secretary of State's office is responsible for attesting the governor's signature on public documents, publishing administrative regulations in the Maryland Register, and engaging with international stakeholders in the diplomatic community. The fiscal 2025 operating budget decreases by around $687,000 to a total of $5.3 million. Moving to page 2, I will discuss the fiscal 2024 legislative priorities later in the presentation. As shown in Exhibit 1 on page 3, the fiscal 2025 allowance of the budget covers around 76% of personnel costs. Contractual services to assist personnel covers 16% of the budget. Now moving to Exhibit 2 on page 4. The governor's proposed budget from fiscal 24 to 25 has a total decrease of 11.5%. The temporary staffing contract for the Charities and Legal Services Division is the largest positive change of around $276,000. Sister States of Maryland Incorporated 501c3 organization grant has the largest decrease in the budget of $982,000. As seen on page 2 for fiscal 24 legislative priorities, the legislature instructed the Secretary of State to distribute the $982,000 grant to the Sister States of Maryland 501c3. The grant is for the Exploring Cultural Linkages Between Black Marylanders and Civil Rights Movements Abroad project. As of January 15, 2024, the funds have not been distributed. Sister States 501c3 is in the process of providing more information to the Secretary of State regarding the use of the funds. Once the Secretary of State approves the initiatives and finalizes the grant agreement, they will distribute the funds to the Sister States 501c3. This is key because the fiscal 25 allowance will not provide additional funding for this grant, and once the grant is distributed, the Secretary of State will see an increase in funds for operating expenses from fiscal 24 to 25. For clarity purposes, the Sister States of Maryland 501c3 is separate from the Maryland Sister States program. The 501c3 is not managed by the Secretary of State and does not receive funding from the Secretary of State operating budget. The Maryland Sister States program is managed by the Secretary of State International Division and will receive dollars from the fiscal 25 allowance for operating costs. Moving to page 5. As of December 1st, 2023, the Office of the Secretary of State reported one position that has been vacant for less than 9 months and one position that has been vacant for more than 1 year. Moving to page 6. The Secretary of State is responsible for charitable organization enforcement. In Exhibit 3, the number of registered charities by 32% increased by 32% from fiscal 18 to 23. The number of charitable delinquencies resolved has decreased by 13% from fiscal 22 to 23. The most significant change is the enforcement activities for non-compliant charities, which increased by 11,834 contacts from fiscal 22 to 23. DLS requests for the Secretary of State to comment on the reasons for the major increase in enforcement activities and whether this level of enforcement activities is expected to continue in the future. Moving to page 7. The Secretary of State is responsible for regulating and renewing notary public commissions. In Exhibit 4, the process notary public commissions decreased by 21.3% from fiscal 22 to 23. The Secretary of State is responsible for operating the Maryland Safe at Home Address Confidentiality Program to help domestic abuse survivors. On page 8, Exhibit 5 shows fiscal 22 to 23, the number of participants statewide increased by 131, the number of participants re-enrolling increased by 100, and the applicant assistant registered increased by 171. The Secretary of State office implements the electronic filing system called ELF that all the state agencies use to submit regulations to the Division of State Documents. The Secretary of State needed to update to a new ELF and wanted to streamline the system to make publishing regulations to the Maryland Register easier. On page 9, ELF procurement and implementation caused delays in the administrative, executive, and legislative review regulation promulgation process, resulting in fewer regulations processed in calendar 2022 versus previous years. The Office of Secretary of State contracted with Digital Management Incorporated, DMI, to modernize ELF. However, they have not fixed all of the problems. Therefore, all of the information has not transferred to the new system, and the employees have experienced increased workloads. DLS requests for the Secretary of State to provide an update on the current status of the ELF system and its functionalities, the improvements that are needed, and an updated timeline for when the project will be completed. On page 10, DLS recommends the Maryland Secretary of State concurs with the governor's allowance. Thank you, and I can answer any questions at this time.
Members who have any questions for Micah? Seeing none, thank you so much. All right, with that, we will invite the secretary or her representative. I see our chief coming and anyone else from the team. You can begin when you're ready.
Mr. Chairman, it's an honor to be here. I do apologize. Secretary Lee would, of course, be here if she could. She's under the weather, but she's on the mend. We're very confident she'll be at 100% soon. So as soon as she can, I'm sure she'll follow up with you. Ann Hoyer also couldn't make it today, but I'm sure she will follow up with you and let us know how we can be of any help with constituent service. I know we provide a lot of services, so don't hesitate. I'm the legislative liaison as well. I'm also the Deputy Secretary of State, Michael Laurie, for the record, with Assistant Secretary of State Fred Smalls. And if I can introduce the team real quick that's joined us.
Please.
So we have the Administrator of the Division of State Documents, Gail Clackring. And we have Mike Schlein, who's the new head of the Division on Charities and Legal Enforcement. We also have Joe Gebhardt, who's the Secretary's senior advisor, very experienced lawyer, and provides great insights. And we're happy to be here in front of you, Mr. Chairman, and the distinguished members of this subcommittee. The Secretary of State's office is small but mighty. We have a lot of varied programs, and we're here to help. Again, if you have any questions about services we can provide, we have many. So it's an honor again to be here before you to concur with the governor's budget. We are excited to present this budget. We think the Secretary's made great progress in the last year. It's a big task, but she comes to this job with a lot of vigor and passion, and she's very appreciative of her former colleagues and all of the insights and words of wisdom you pass along. So don't hesitate to reach out and provide insights. And Mr. Richards, thank you for your brief of our agency. And I think we're on a much more sound footing this year. We've got a lot of functions, as I mentioned. The Division of State Documents is really crucial. And Gail, you should know, is a confirmed member of the administration. She has been around a few years, but in the agency for a few decades. And she's got a lot of great insights for the important functions of her division, the Division of State Documents, which does oversee the ELF system. That was a contract actually through DoIT, and with the vendor, we've responded to some of those questions. It's in our written testimony. We can highlight that. But we are in strong partnership with DoIT. We're governing through partnership. We're very optimistic that we can turn that program around. We really think we need a database, and we're addressing those problems head on. And we're very optimistic that we can resolve them. But as of now, the system is very inefficient. And we want to make good, smart investments in government so that we have effective and efficient investments for the citizens of the state, of course. So the DSD, the Division of State Documents, provides electronic subscriptions to COMAR, also in print. But of course, with COMAR available online for free, you can imagine the subscriptions have gone down quite a bit in the last few decades. The revenue structure of the DSD Special Fund is something we're going to look at in future years. We don't deal with that this session, but we will probably circle back to that at some point because it's an old paradigm. The charities and legal services, just to highlight a few highlights, and I'll turn to the questions real quick. The notaries public, we have processed 14,085 new and renewing applicants for notaries. There is a new notary database. It's modernized, it's live, it's working well, but there are some bugs, and we're working to resolve those. The charity division, it's a really important function of the agency, but of state government as well. We want to encourage generous donors to feel confident that their donations are going to go towards the charities and causes which they're donating. So the enforcement of those charities is crucial, and we've beefed up our enforcement. We're anxious to fully implement. We have a position for a forensic auditor and an investigator to allow us to have much more breadth over the ability to enforce the charities so that the money again goes to the entire intended recipients. We have 11,996 enforcement actions for charities with delinquent registrations. To answer the question that was raised, that's due to our new system for charities. It's an automation function. Actually makes it much easier for all parties because automatically if there's a delinquency, they get the notice before the fees start accruing. So they're made aware, and those fees are then sent to the agency. So we have those funds instead of just sending requests out or trying to look through our records. It's sent out automatically, so we think that's more efficient and pragmatic for everyone involved. We have also processed 394 extraditions. People don't realize we process extraditions, but we work with the Governor's Council, and that's an important part of our portfolio. We also run the Maryland Charity Campaign. There was nearly $2 million raised in the 23 campaign. Thank you to all the state employees who've donated to that. We know times are a little tight, and that money goes to registered charities within the state, and it's very much appreciated, I know, by those participating charities. And I think we're here today because we also run the address confidentiality program. That's why we're, I think, with these other agencies, and it's a really important program. Secretary Lee, when she was a senator, actually sponsored legislation supporting the address confidentiality program. We now can shield deeds, and we've shielded nearly 89. We're processing near the 100 mark of deeds. So even if you own your property, you can be a participant in the address confidentiality program. There are 1,670 participants active in the program. Most of those participants rent. It's a much more easy process to shield someone's information if they rent, but your driver's license, your electric bills, and what have you, it's all our address, 16 Francis Street, instead of the true address, and we forward their mail so that it's a lot harder for their alleged abusers to find them, and the program is now expanded to any individuals who are threatened. That's an important change that was made in law about 2 or 3 years ago. We hope more people will avail themselves to the services of the address confidentiality program. So 5 people apparently have been approved under that new threshold, but I do imagine there are many more who just didn't identify that as the reason they were able to avail themselves to the program. And as we get the word out, we're hoping more people will be aware of that eligibility change. We do have 874 active application assistants who may work at the House of Ruth and or other agencies or entities that work with victims of intimate partner violence, and they help get the word out how to apply. So again, we concur with the governor's allowance. Let me also highlight, we did get a VOCA grant. Very happy to be recipients of a $164,000 VOCA grant. That was for this fiscal year, and we're very hopeful that we can continue that into the next year. It's really important for the viability of the program, and we're happy to have worked with Dorothy Lenning and others at, now I guess it's GoCap again, very important funds that, again, go to a state service provider. So thank you.
Thank you, Michael, and please give our best to the Secretary. We hope a speedy recovery for her. Before my questions, any members have any questions? Delegate McComas?
I know the judiciary, after the loss of Judge Wilkinson, is very concerned about safety, and I understand the guy followed him to his home, but are you encouraging the judges to use your confidentiality? Because that was my understanding that several of them, because we put in a bill and you guys took it, it didn't go anywhere because you guys were taking care of the problem.
Well, I am aware of the bill and certainly the problem, and we've been working with the judiciary at large to make sure they're aware that they are basically all eligible to join the program. The problem with a lot of judges is they wouldn't want to have to move, and to be a participant in the program, you would have to move. So I think they're exploring some other ways to shield their identities online. And I do think there are ways to do that. New Jersey has a very...
In other words, they think they would have to move their house or something?
You would have to move your house. And you could be eligible under the deed shielding program that we have. But again, of course, it's a lot to make someone move and uproot their family, what have you. But of course, if you are a bona fide target, a lot of people are willing to move. But for judges who might have just threatening...
So that is criteria, though, that they have to
You would have to move to be a participant in this program. But there are other efforts I am aware of to shield information that's online. And you have to be careful about First Amendment concerns. But I do believe they're pushing ahead with that, and we would fully support those efforts.
If everybody starts doing that, though, are you going to figure out a way to create some kind of cost if they're able to pay for it? Because I think as things get more complicated, people may want to join that program for different reasons.
Well, that's a very good question, Delegate, and I know there's some relocation costs that are associated with moving, of course, even if you're just renting, of course. They have that for state's evidence at the county level, and we have been exploring that at the state level. We don't have a funding mechanism at this point in time, but we have been talking with GoCap about the potential. It's a very great thought.
Okay. All right. Thank you. Thank you, Mr. Chair.
Delegate Stanko?
Yeah, thank you, Mr. Chair. Question I had is around the ELF system. Primarily just last year we heard kind of a similar message. So really 2 questions. What is the arrangement looking like with the vendor? How's that improved, gotten worse, stayed the same? And what's the timeline for this fix to be put in place, and what's the expected cost increase for that change or that increase?
Well, thank you for the question. The vendor has been responsive to fixing some bugs within the system. We do feel that it's probably a design flaw. So chances are we're going to need not a new RFP, at least a database and a new system. It's not going to be that expensive. We're talking maybe $200,000, but it certainly would cost probably at least that much. We don't think to generate a database would necessarily cost much. You could use a bot and you can scrub our web page. So we do have an ASPX. It's not a database, but we have all the files online. And we do have an ELF system. The problem is when they put it up, they made it run live without a beta testing process. And some of the files didn't fully migrate. So the best repository we have are the physical regulations and what's online. So we'd have to create a database at this point, and we're working closely with Do It. They have promised us quick response to the issue now that we have exhausted patching the old system. We really do, I think, need to move towards a product with a database. So they have told us they're 100% behind us. We're working in close partnership with them.
Are we targeting, thank you, are we targeting 12 months from now, 20, like what's the?
Well, I haven't heard a specific time, but I would hope we would have a database in place in the next few months. I would hope we'd have a fully operating system because our staff, I would estimate, has 4 or 5 times as much work related to COMAR and the registrar because of the inefficiencies within the program. So it's very urgent that we get that efficiency back up and, of course, have a robust and a database that we're confident in. But don't worry, we have all the regulations. They're not lost. The problem is the system just didn't really migrate everything within the system itself.
Great. Thank you.
Yeah.
Thank you. So the question I have, Delegate Stanko touched on one of them. The other one is related to the international affairs component. So, this is a question. The question is, I want to know if you can elaborate on the office's work to engage the international community, particularly from a business sense of investing in Maryland. And I'll give a backdrop. I've had conversations with the governor and them about the Inflation Reduction Act federally. For many of these international businesses to gain access to the U.S. market, they have to do, let's say, last mile manufacturing within our continental shores, okay? And with one of the most diverse states in the Union, the 4th most diverse, most on the East Coast, it would seem to me that we should have an advantage in reaching out to some of these folks. So if you could opine to what degree we are trying to engage either embassies or just international business community to position Maryland.
Well, I can tell you Secretary Lee is relentless in this space. She's active at many embassies. I give her a frequent flyer card, but I think she would probably, wouldn't be able to cash in the benefits because of our ethics rules. But she hasn't been able to travel much because of our travel fund, but we being strategically located in the D.C. area, you're right, there are so many competitive advantages for Maryland. We are America in miniature. We've got access to huge portions of the market within 24 hours of driving. We've got competing rail lines. We've got great road infrastructure. So she's trying to make sure that everyone realizes, not just within Maryland or the country, but everyone in the world, that this is Maryland's decade. There are once in a lifetime opportunities through IRA and other the benefits through the Department of Energy for grants. There are so many opportunities right now. So, and a lot of those are available for foreign companies as well as domestic companies. So she's doing her best. I joke, she's cheerleading. I maybe like to say I'm a hype man, but we like to make sure that Maryland is on everyone's mind. And we're doing the circuits. We're talking to everyone about Maryland businesses abroad, but really also bringing that investment to Maryland. There are a lot of opportunities to bring, China, for instance, is having a lot of problems with their economy. There's a lot of interest. And of course, she's got relationships with Taiwan, but also the PRC to bring some money back to Maryland. Because the governor, of course, is focused not just on, tapping into investment from the legislature, but from the private companies and entities around the world that want to do business in Maryland. We've got the highest educated population. We've got diversity. We've got the markets. This is the place to do business.
Yeah, we have the Port of Baltimore and we have Washington, D.C. right to our west. And I would say that, the federal government is making this once in a generation industrial investment. And Maryland, once upon a time, was one of the manufacturing capitals of the nation, particularly in Baltimore and in Western Maryland and certain parts, even in the Central Corridor. And I think it would be a huge missed opportunity for us not to seize that. So however this legislative body can be in support of that, we will. So thank you so much. Any further questions for Secretary of State? Thank you guys so much. All right, next we'll bring up the Office of the State Prosecutor, and then we'll go to corrections. So can Jacob come over? Thank you.
There we go. Alrighty. Thank you, Mr. Chair. Jacob Polakov to present the analysis for the Office of the State Prosecutor. Just a refresher, State Prosecutor's Office is an independent agency within the executive branch in charge of investigating and, where warranted, prosecuting criminal offenses affecting the honesty and integrity of governmental officials, institutions, and the electoral process, including certain criminal offenses, including election law and public ethics law violations, state bribery law violations involving public officials or employees, misconduct in any office by public officials or employees, and extortion, perjury, or obstruction of justice. The state prosecutor may also investigate and prosecute any offense that takes place in more than one county within the state or in more than one state, including Maryland. On page 1, we'll see that the fiscal 25 budget increases by just over $300,000, or 11.1%, to a nice round $3 million. And on page 2, we have Exhibit 1, which shows that approximately 88% of OSP's budget is dedicated to personnel spending. Other significant parts of the budget include spending on contractual services, namely services involving transcriptions for depositions, interviews, and other proceedings, along with rent for their office space. On page 3, we have Exhibit 2. The fiscal 25 allowance, as previously mentioned, increases by $307,353. The increase is largely driven by a reduction in the turnover rate from 8.62% down to 1.01%. Some things that I want to highlight within Exhibit 2 are the costs associated with one new paralegal position, along with reclassification costs associated with 2 investigator positions and 1 paralegal position, along with the removal of funding from fiscal 24 in the fiscal 25 budget, that one-time funding for new computers and vehicle purchases. On page 4, we have a breakdown of the personnel data, showing that OSP has 0 vacancies right now, which is something to be proud of. The reduced turnover rate indicates that the number of necessary vacancies, excluding any new positions, of which there is 1 new regular position, but the number of necessary vacancies is 0.16. The 1 new position, fiscal 25, as previously mentioned, is a contractual conversion of paralegal position to support the work of the new unit focusing on official misconduct and special victims. On page 5, we have the first key observation, which discusses the new unit within the office for investigating official misconduct and special victims. In fiscal 24, OSP created a new unit within the office devoted to investigating official misconduct as well as cases involving special victims. The existence of this unit allows OSP to place a more direct focus on cases involving matters of official misconduct and cases involving special victims, and to separate this work from the other areas of the office. This unit is focused on, well, first of all, the crimes for which it's named, but also on bringing awareness to these types of cases and educating agencies about what constitutes official misconduct or a case involving a special victim. Data regarding the performance of this unit is not currently reported in the annual Managing for Results, the MFR report, published by DBM. At the time this analysis was written, OSP's self-published report was also not yet available. However, OSP was able to inform the Department of Legislative Services that the agency did receive 58 complaints in fiscal 23, which would fall under the purview of this unit. Tracking the number of complaints as well as the results of complaints, including investigations, prosecutions, and convictions, would be helpful in analyzing the performance of this unit of OSP. Therefore, OSP should comment on how the work of the new unit will impact existing OSP staff, and if additional personnel are expected to be needed as the unit takes on more cases. OSP should also work with the Department of Budget and Management to add sections tracking data specific to cases involving official misconduct and special victims to the MFR. Key observation number 2 begins on the bottom of page 5, and you'll find Exhibit 3 on page 6, which shows the number of complaints, investigations, and closed cases since fiscal 2019. The number of complaints submitted to OSP continued to increase in fiscal 23, reaching 710, which was an increase of about 62% from the previous year, 271 complaint increase. The number of open investigations also increased from 63 cases in fiscal 22 to 109 in fiscal 23. OSP was able to close 263 cases in fiscal 23, a 54% increase from the prior year. And you'll see expanded data on that, as I said, in Exhibit 3 on page 6. This data indicates that OSP's case management system is achieving the agency's goal of making it easier for complaints to be submitted to OSP, and that the greater number of complaints and investigations is not stopping OSP from managing cases and closing them in an efficient manner. OSP currently estimates the growth in complaints and investigations to taper off in fiscal 24. However, if this growth does not slow as expected, OSP should consider how continued growth will impact their operations and what they can do internally to continue to effectively manage the growth in those metrics. Those considerations might include caseloads for attorneys and paralegals, how long OSP takes to process different types of cases from start to finish, and how each area of work is impacted by the increased numbers of complaints and investigations. Key observation number 3, beginning on the bottom of page 6, regards election law referrals and enforcement actions increasing. OSP is responsible for investigating referrals related to potential violations of state election law and making impartial decisions on enforcement and prosecution where warranted. Common violations referred to OSP by the State Board of Elections include failure to file required reports or pay required fees, authority line violations, voting by non-citizens, and overcontributions. The number of referrals tends to fluctuate in concert with the federal election cycle. So we'll see in odd-numbered fiscal years an increase generally as a result of the federal election year in the previously numbered calendar year. So as such, fiscal 23 saw an increase in referrals over the prior year. However, the number of referrals in fiscal 23 was also more than double the amount from fiscal 2021, and the number of enforcement actions also grew significantly in 2023 as compared to fiscal 21. Exhibit 4 on the middle of page 7 shows the number of referrals for fiscal 2019 to fiscal 23, along with the number of enforcement actions in each year since fiscal 20, which is the first year that that metric was tracked. These large increases in referrals and enforcement actions from previous election years represent what looks to be at this point an outlier of a year. Data regarding referrals, as previously mentioned, was not tracked in the same way prior to fiscal 2019, so there is a limited scope for determining if similar spikes have occurred in the past. OSP has stated that the increase in referrals in fiscal 23 is due to a number of factors, including a new reporting process implemented by SBE, as well as increases in certain types of complaints. That new reporting process from the State Board of Elections allows the State Board of Elections to transfer complaints to OSP at a faster pace as opposed to the previous process where complaints were sent to OSP in bulk after an election. OSP has also reported an increase in complaints involving theft of campaign signage, non-citizen voting, and double voting in fiscal 23. These increased complaints led to an increase in enforcement actions. OSP has also stated that one person or group can receive multiple enforcement actions as a result of a singular complaint. OSP should comment on if the number of referrals is expected to decrease back to prior levels in the next election year, and if and how the higher number of referrals and enforcement actions impacted their operations in fiscal 23. On page 9, you'll find that DLS's recommendation is to concur with the governor's allowance, and I am happy to take any questions.
Thank you, Jacob. Any questions from the members? So I have one. I just want to confirm for the record that an increase in referrals or even enforcement actions taken isn't necessarily saying there has been double voting or there has been anything like that. It could just be them closing out cases and saying nothing happened here or it wasn't substantiated.
That could potentially be correct, yes.
All right. I just wanted to confirm that. Thank you.
Absolutely.
With that, do we have a representative from the state prosecutor? Yes, thank you. Thank you. You can begin when you're ready.
Thank you, Mr. Chair and members of the subcommittee. My name is Charlton Howard, and I'm the Maryland State Prosecutor. I appreciate the opportunity to talk to you today about the important work of our office. We very much appreciate Jacob's efforts and his quite thoughtful analysis of our work, and we appreciate his recommendations and taking them on board. I'm joined here today by our Deputy State Prosecutor, Sarah David, who's at the end, our Director of Administration, Ruth Sweeney, who's sitting to my right, and the new Director of our Special Victims Unit, Mary Setzer, who's sitting one over from my right in here. We submitted written testimony responding to the specific requests. I just wanted to highlight a few things, and then we'd be happy to entertain any questions regarding that or any other aspect of our mission and efforts. As mentioned, the Office of State Prosecutor has jurisdiction over specific crimes related to political corruption, official misconduct, and election law. I'd like to really address two areas of interest. First is last year the Assembly made it possible by providing some additional funds for us to hire a Special Victims Unit prosecutor and investigator. We were thrilled to hire Mary Setzer, who joined our office from the U.S. Attorney's Office, where she led that office's efforts targeting human trafficking and served as the office's Violence Against Women's Act coordinator, prosecuting numerous federal human trafficking, child exploitation, and sex crimes cases. Mary was also formerly the chief of the Domestic Violence Division, the Special Victims Unit in the Anne Arundel County State's Attorney's Office. We also hired Special Agent Jeff Stauder, a retired Baltimore police detective who has investigated sex offense and internal affairs cases for over 2 decades. These additions enhance our ability to investigate and prosecute where appropriate official misconduct complaints involving sexual assaults or sexual exploitation. And they also allow us and posture us to provide training to administrative organizations, many of our partners, such as Human Resources and Internal Affairs Divisions, to identify potential criminal special victims cases at the complaint stage, particularly when these cases start as an administrative complaint, thereby limiting re-victimization, because every time a victim has to be interviewed about one of these very sensitive matters, it contributes to the trauma, contributes to their abuse, quite frankly. It allows us to preserve evidence and enables us to conduct a successful investigation and a prosecution if that turns out to be the appropriate solution. Again, this unit's very victim-focused in providing those services. I also want to talk about our election law complaints, which, as Jake has mentioned, have grown significantly over the past 5 years. Internally, we've signed some additional resources, readjusting a few things to dedicate more efforts to our election law efforts to match this growth in complaints. As always, our goal with election law, with our election law mission, is first and foremost compliance. We're really not out there hunting scalps or trying to punish people. We're trying to get people to comply with the Maryland's electoral laws. And the last thing we want to do is deter people from participating in the electoral process by overly aggressive enforcement. But sometimes you just have to take efforts to keep that, to deter people from not following the rules. And in some cases, you have where there's outright thefts of campaign funds or embezzlement, there's no choice but to go forward with an investigation and a prosecution. Evolving technology, well, I should mention, the growing numbers Jacob mentioned reflect several different kinds of complaints, including the failure to file required reports, double voters, non-citizen voters, and some other types of election law violations, and I can certainly address any of those if there is specific interest. Evolving technology makes our enforcement more complicated and is making violations more widespread. For example, this year we cited the 1776 Project PAC for a fine of $20,250 for over 13,000 text messages that were sent out in relation to a campaign without an authority line. Traditionally, authority line violations would be treated by take your sign down, here's a relatively modest fine, just to make sure everyone knows you have to have an authority line. But now, with the advent of such advanced technology, where you have access to thousands of people with the press of a button or phone calls, requires more scrutiny to ensure the public knows who paid for the information they're receiving about candidates. And we anticipate that we'll have to continue our efforts to keep up with technology in this matter and to leverage DoIT and our other technical partners to make sure we have the resources to address those kind of issues. While our resources are limited, we work hard for our important mission. I'm very proud of our zero turnover rate. I think our people have a passion for the work. We pride ourselves on our independence and our political neutrality as we address these cases coming forward and try to address each case on the merits. We appreciate the governor's allowance and concur with that allowance. So thank you so much for your attention, your support of our office. And at this time, I'd welcome any questions, and if they're for myself or my colleagues to address.
Thank you. Delegate Stanko?
Mr. Chair, just curious, in the 1776 pack, I'm well informed on. I'm from Carroll County, so a question for you was that the only case of in the last election cycle that you got that had a scaled text messaging operation in terms of complaint that you got that met that same met that standard, for lack of better terms?
Certainly, that was the most extreme case. Sarah, David was our prosecutor on that case. Sarah, did you want to add anything to that?
Sure. So we don't comment on cases where we don't take enforcement action to maintain anonymity. But I'll say that we treat all cases the same as far as they reflect kind of this idea of how many times something was distributed. So because of the advent of technology, our office is taking kind of, instead of one instance, is taking it to the instances that we can show the mass scale distribution. And so that's why it was applied that way in that case, because we could show the 13,000 plus text messages. And if we have other cases and other matters where we can show that amount of text messages or that amount of distribution, then that's how we're going to be treating those cases going forward.
Okay, I appreciate the context there. Not speaking to a specific other case, right? But broadly, did you have any other cases that had any other case complaints that came in that had a mass level of mass distribution list that could have met the same standard?
So I think
even if it wasn't 13,000, but it was 1,000.
Yeah, I think that what we're seeing and what I can say that we're seeing and where we've looked into kind of how to take enforcement action is on things like maybe it will be one Facebook post, right? But the ubiquity of that post, how many times that post is shared, how many times that post is viewed, but that's still one post. That would be treated differently than what would be 13,000 plus distributions. And so that's how we would bifurcate the difference. So when we see cases that involve distribution, that we can prove each incident of distribution, then each incident of distribution is going to be charged and fined.
Yeah, I understand what you're saying around the differences in how the technology is applied versus how it and I guess it's just maybe something we can go offline on or outside of the record. But I would like to get an understanding of and again, it doesn't have to mean that someone complained that Josh Stanko did it and I was investigated, it was found unfounded or whatnot. But did we have any other, without commenting on who, did we have any other cases that we chose not to take action on that maybe didn't reach the scale of the 1776 pack, but was of but had the same similar model, right? So it could be an email that went to 9,000 people that didn't have an authority line. It could be a text message that went to 6,000 people that didn't have it. So I understand what the differences is, but I'd like to understand if there were any others that we chose not to take action on for without it necessarily needing to be applied to it, to knowing who the specific group was.
Okay, we can try to figure out a way to anonymize that data and get back to you with those numbers.
Sure.
Thank you.
And I just want to clarify one other thing when we talk about enforcement actions, and I think it came up. It's that we can have one, for example, failures to file. I'll work out this stammer quickly. Failures to file required reports. As everyone knows, when you move into an election year, your number of reports that you have to file increase. Everyone who's been a political candidate. And so we'll sometimes get 6 referrals on one person. We'll take one enforcement action, and that will address or resolve those 6 referrals. And that's why we have a large number of referrals, and we don't have the exact same number of enforcement actions. Of course, we'll get some referrals that are beyond the statute of limitations, or it turns out not to be a violation, or it's not really a political PAC or entity, a campaign finance entity. It's just an individual exercising their First Amendment rights to say something, and of course we won't take any action in those cases. But I just want to clarify that description because there's a little bit of sticker shock when you see that number of complaints, and it does require additional resources. As Jacob mentions, we are keenly aware that if these complaint numbers keep going up in both our the general criminal numbers as well as our election law numbers, then we're going to be in the position probably to need some additional resources. But we've got a 16-person agency now, and I think it's really miraculous that we've managed to keep a lid on it. I think do a very professional job with those numbers. And if the numbers stay the same, we can continue. If the numbers keep going up, then of course it might be a different ballpark.
Yep, appreciate that. Thank you. Thank you both.
Yeah, thank you. Mr. Prosecutor, I think there's a follow-up question from Delegate McComas.
I don't really know what the answer is, but my question is let's say there's a lot of folks out there that want to get involved in, let's say, email messaging, and they really don't understand the political process. And let's say they're not really trying to capture just one person. Maybe it's a philosophy or anything. Are there rules as to when you need that authority line and you don't? I mean, obviously, if you're a candidate and you're running for office or you're soliciting money, you need the authority line. But if you're just kind of like this sort of amorphous, moms demand action, I'll use that as an example. Do they want to fundraise, and they want to, and they're anti-gun. I mean, that's their and they come from, they're sort of come from Sandy Hook. Do they need an authority line? If basically they are subject matter advocates.
We navigate that area quite often, and particularly that's one of the in our protocol. One of the first questions we ask about authority line, if they're one of the entities that are required to do that. I mean, Sarah can address it further. She's worked a number of these types of cases, but the State Board of Elections does put out guidance on when you do and do not need to comply with those regulations. Sarah?
Sure, and so I think that there's kind of three levels of sort of enforcement action here. I'm not going to comment again on any specific groups as to what they have to do, but kind of as an overarching element. So you have what are like the 501c3 tax-exempt groups federally. Those groups can talk about issues and talk about other things, but they can't talk about candidate-based advocacy, vote for, et cetera. So when you see sort of when you see topics related to elections, that's going to trigger a lot of filing requirements. When you see topics that are related to issue-based advocacy, we support this type of issue, that's a federal level C4, also tax exempt, but doesn't trigger the same types of disclosure requirements. However, if they were to transfer that over into issue-based advocacy that supports a candidate, right? Vote for, et cetera, that's going to put you into a PAC space, and PACs have to register, and then they have to have the same filing requirements. That is easy to explain to all of you because of what all of you do when you run for office. So and those have the same kind of fundraising limits, right? Issue-based advocacy, unlimited funding, but as far as sort of what candidate-based advocacy is. Then there's this kind of separate category when you're talking about legislative efforts. And so that's going to be vote against this bill. We don't like this, we don't like this. We want your delegate to do X. That's going to be whether they have to register as a lobbyist, right? Because we're not saying elect, we're not in a campaign space. We're in an issue space, but are we into lobbyist space? And so, again, we have lots of different agencies here between the tax-exempt issues of the federal government, our work with the State Board of Elections as it relates to kind of PACs and campaigns. And then we also have joint enforcement over the ethics people, but that's going to be a separate space as to do you have to register for a lobbyist. That's overarching. Absolutely happy to follow up with you if there are more specific questions, but that's just kind of, the guideposts of the space.
The bottom line is if somebody wants to do something, they should give somebody a call that knows what's going on, right?
Yes, and again, everybody's goal is compliance. So if they reach out to state ethics or they reach out to the State Board of Elections, they can always reach out to us. Our goal is compliance. We're not trying to get people in a gotcha game.
You mean you're not a gotcha agency?
No, not with 16
well,
people.
That's good to know. Thank you. Sure. Thank you, Mr. Chair.
Trust me, there's enough people that we don't have to go gotcha on.
Any other questions from members here? First, I just want to say, for anyone who's listened, Moms Demand Action is not inherently anti-firearm or gun. They're pro-public safety. I'm sure someone's going to post online about that. But I just wanted to clarify before I get a call. The other thing is, I don't think you're going to worry about them calling you. They'll call me. But you all respond to complaints that come your way. One question I had is, in what avenues is the Office of the State Prosecutor able to, I guess, proactively? Because I think what I heard is complaints that people issue, you respond. It may be multiple complaints from one thing or not. Do you all just initiate on your own account things that do not come from a complaint?
We absolutely can. So if we come across information, if you see something in the paper or the news or talking to someone, and you have information about something that's in our jurisdiction, we can absolutely initiate action. A large number of our complaints, we do get referrals aside from the referrals from the election law area from the State Board of Elections, but we do get complaints. I know this would be a shock to many of you, but sometimes one candidate will complain about another candidate's campaign issues or things like that.
Never.
It's very rare, Mr. Chair, but it does happen. So we do get complaints from members of the general public. We have one of the things I did when I took over about a little over 4 years ago was I said we needed to have an electronic case management system. Jacob made an allegation because all professional investigative organizations need one in order to do the work properly. If you can't measure it, you can't manage it. I also established and I say we, because I didn't have the technical expertise, but I knew what we needed to do, and we brought the technical expertise in to have a complaint portal on our website, and where we can direct people to, and in our annual report and our other media outreach, say if you have a complaint or an issue that you believe is something the state prosecutor can address, you can go online to our website, and we have a portal, a process they can fill out. They can choose to remain anonymous. They can give us contact information, and we get a large number of complaints that way. A number of them are not, like I say, no good deed goes unpunished. We get a lot of complaints from the general public. Some of them are clearly not in our jurisdiction, but we look at each one. One thing I'm very proud of is I personally review all the complaints with my team, but I am making the final decision whether to take a case or not take a case. What I'm very proud of is that if I see a wrong there that is not within my jurisdiction to address, but we have a lot of agencies, state agencies, local agencies, federal agencies, and I know that that agency can address that wrong. I refer those complaints to that agency in triage. And so the majority of the complaints that we don't engage with ourselves are referred to another agency that is within that jurisdiction. So that we do get cases that way. We established social media accounts. I'm not the biggest social media person in the world, but that's the wave of the future now. And so we have put out social media accounts, public outreach, both Facebook and Instagram and what was Twitter and these LinkedIn, so that you can reach and get out to the professional community. And when you find a lot of state officials, a lot of state employees and local municipality employees are on LinkedIn and Facebook and things like that, and they see that, and so that sensitizes them to our office. And the about information is where our website is, how you can file a complaint. They don't have to go to the website. We still take telephone calls. We occasionally have a walk-in. How they find us in the depths of Towson, I don't know, but there are people that have those investigative skills. They find where our office is, they come in, and we take complaints that way. And hopefully that answered your question, Mr. Chair.
That did, because my follow-up was going to be, I imagine the increase in complaints had to do with some advertising as well, and you answer that, which is, from where I stand, a good thing. I think, people knowing where that resource is means more complaints, whether they end up substantiated or not. I think part of serving the public is just giving people the chance to feel heard, and if they know where they can go to issue their complaint, that's part of the process of feeling heard. So thank you for the work that you guys do. Any further questions from the committee? Seeing none, thank you guys so much.
Thank you, sir.
Now we are moving over to Department of Corrections, and we'll ask Jacob to come over from DLS to do his overthrow. And also to the corrections team, thank you guys for your patience.
Thank you, Mr. Chair. As you said, today I'll be going over the DPSCS budget overview, highlighting some key areas of concern throughout the department. Some of those key areas are highlighted on page 2 in the key observation section. I'll be going over CO employment rates dropping, turnover improving for some other positions, the growing population in their custody, as well as a medical contract dispute, new procurement, and an issue regarding programming participation data. Starting off on the cover page, you can see that the DPSCS budget totals $1.6 billion in fiscal 2025. That budget is stable between fiscal 2024 and 2025 with only an increase of $1.5 million. The performance evaluation begins on page 4 with Exhibit 1. For the departmental overview, this is mostly looking at population statistics. From a historical perspective, the population is much smaller now than it was in the past. In fiscal 2023, there were 17,897 individuals on average held each day in DPSCS facilities or awaiting transfer to DPSCS in local jails. Over the past 10 years, there was a 28% decline, but from 2022 to 2023, there was a 1.4% increase in the overall DPSCS population. That's mostly seen for sentence populations. The pretrial populations actually slightly declined for the second year in a row. Exhibit 2 on page 5 shows the quarterly trends in population since fiscal 2019. So this really highlights the changes that happened during COVID and since. The current populations are growing each quarter, and that growth has not subsided since reopening in July 2021. Each month, DPSCS is adding about 54 sentenced offenders while reducing pretrial offenders by about 14. As I previously just mentioned, the pretrial population is not increasing, but Exhibit 3 on page 6 shows the intakes to pretrial detention are actually increasing. So the number of arrestees and the number of admittments that are booked into Baltimore Central Booking increased in 2023. There's a 21% increase in arrestees and a 6% increase in those committed to pretrial detention. Moving on to community supervision, Exhibit 4 on page 7 shows the various community supervision programs that DPSCS operates. Excuse me. Criminal supervision cases, including parole, probation, and mandatory release, increased again from their lows in 2021 that had been related to court closures. This also extended, the increase is also extended to the pretrial release services program, as well as the drinking driver monitor program, which increased by 11% and 2.5% respectively. Those are still lower than pre-pandemic levels, but we are seeing an increase. Moving on to the budget, on page 8, I'd like to draw your attention to the proposed deficiencies. There are several deficiencies totaling $75 million in fiscal 2024. Most of these are related to the medical care contract settlement, as well as an extension for that contract. The contract, there is a contract dispute, which I'll be going into more detail in just a moment, but that required $32.7 million in deficiencies. And then the extension, which has been provided for 6 months, would be an extra $20.9 million. There was also a secondary judgment related to the overtime payment miscalculations that the U.S. Department of Labor has been investigating with regard to DPSCS. So that secondary amount was included in fiscal 2024 to retroactively pay those officers who were shorted. Finally, food and electricity costs were higher than expected. In these areas, they had about twice the level of inflation as other areas, and so the department's budget was not sufficient. Moving on to the $1.6 billion allowance, Exhibit 5 on page 9 breaks this down by the major spending area. Personnel costs are the largest for the department, making up 2/3 of their budget, and this is for the over 9,200 allowed employees. I would also point out the healthcare contract is $233 million, and this is more than we've had in past years because of that extension. Moving on to Exhibit 8 on page 14 and continuing on to page 15. This shows the change in the proposed budget as per the governor's allowance. The largest changes are in personnel, as well as in that medical care contract. Salary enhancements added $37 million, including fringe benefits like healthcare, while another $23 million in turnover expectancy was added due to bring the budget in line with actual hiring. Overtime earnings are decreasing in the allowance by $14.5 million, although I would flag that as a concern. It does not appear that overtime utilization is reducing commensurate with that, so there's a possible budget issue there. Other budgetary increases of note are for food and dietary costs, as well as IT support from both private companies and the state agencies like DoIT. There's an increase of nearly $1 million in medical costs when including the deficiencies for extending that contract, although that increase may not be enough if the replacement is more expensive than they're currently expecting. The funding reductions on the next page, the primary one that I'll point out is $3.5 million that were provided in fiscal 2024 that is not being repeated for upgrading the facility mailroom so that there's less chance for contraband to get through. On page 17 begins the pretrial data section, and there are 4 positions that are transferred out of DPSCS into the new Governor's Office of Children, which has been separated from crime prevention. The vacancy rate for the department is currently 12.6%, which is higher than budgeted at 11.9%, but is much closer to reality than it has been in past years. Vacancies compared to last year are 280 positions, there's 280 fewer vacancies now than there were last year. Exhibit 9 on page 19 shows the administrative employee filled rates ordered by the number of vacancies in each classification. So Exhibit 9 shows that the most vacancies of any classification are in correctional dietary, maintenance, and supply officers, although there are lower filled rates among some of the mental health positions, so counselors, psychology staff, and those mental health staff. On page 20, Exhibit 10 shows the number of filled positions over time. The filled rate is lowest currently for administrative positions, although, as I just mentioned, they have improved those filled rates this year. CO vacancies are actually increasing, and there were 681 correctional officers that the department needed to fill as of December 1st, 2023. Exhibit 11 on page 21 demonstrates these changes in vacancies over time, and this highlights how administrative vacancies have been reducing pretty rapidly over the past year, whereas correctional officer vacancies have been increasing. So while the department has made an overall improvement in hiring, there still remains issues for correctional officers. Exhibit 12 demonstrates that change in correctional officer staffing each month for the past 2 years. In each of these past 2 years, 9 out of 12 months saw a decrease in correctional officer employment, while a few months in this past year saw increases. The overall change was a net decrease of 123 COs. Moving on to overtime, so Exhibit 13 on page 25 shows the overtime funding since 2014, and this has been a concern of the state and of the department for many years. It's been increasing almost each year. This year it reaches $185.7 million in fiscal 2024, but they are expected, or at least budgeted, to decrease in fiscal 2025. As I alluded to earlier, Exhibit 14 shows overtime hours worked are actually not decreasing, so that allowance may not be enough to cover their actual overtime needs. Exhibit 14, you can see that the hours worked have been increasing since they reopened in fiscal 2021, and year-to-date in fiscal 2024, overtime was still just as high, or if not higher than in the past year. From January to August, that overtime data is laid out in Exhibit 15 on page 27. they have been, on average, needing more overtime each pay period by about 180 hours. The concern is not only the costs, but also the effect that this has on the lived experience of the correctional officers, their willingness to stay into state service, as well as the safety concerns that are associated with having tired or inattentive officers. Moving on to the medical contract issue on page 28. DPSES has a contract with, or previously had a contract with Corizon. Corizon went bankrupt and they have been reconstituted as ES Care. But this contract was initially signed between DPSES and Corizon, so for consistency's sake, I'll stick with Corizon. That contract had a number of disputes that were brought up to the State Board of Contract Appeals. One of the core issues was an accounting methodology that was outlined in the original RFP, but it did not align with the way that these are typically done. It denied Corizon a 50% subsidy for recovering Medicaid payments, and there were other issues on both sides. But the state, at the recommendation of the Office of the Attorney General, settled with Corizon for about $39.7 million in total. About $20 million of that was a settlement agreement amount, and about the rest of that was waiving liquidated damages. So some of that was absorbed in fiscal 2023, but a proposed deficiency of $32.8 million was required to allow the department to pay for the rest of that. The contract period also ended in December of 2023. They have extended that contract until March, and there are funds provided to support an extension up until the end of the fiscal year. That added $20.9 million to the budget, and there's approximately there's a little bit more than that in fiscal 2025, but there is concern that more might be needed, particularly since the cost of labor for these positions has increased substantially since the original contract was signed. There have been a number of changes at DPSES enacted in order to fix some of these problems related to the contract dispute. Particularly, a staff of 7 auditors was assigned to make sure that the liquidated damages that were waived are being used for staffing increases and not being used for any other purpose. They also began assessing for those liquidated damages again, and providing that subsidy. That was one of the issues in contention. They also have incorporated into the RFP that has recently closed, so they're looking at the current options. They incorporated into that RFP the requirement that the vendor pay at least in the 75th percentile or better of the labor index for those positions. DLS is asking DPSES to comment, DLS recommends that this committee narrative be adopted, that when DPSES makes this award, they notify the General Assembly and provide information on that decision. Because overviews do not contain the text of that recommendation, it will appear in the administration analysis, which will be coming up next week, I think, in this. Yes. Moving on to the final issue of the day. This is a 3-parter regarding programming participation. So Exhibit 16 on page 30 starts the first part of this, which is Threshold. Threshold is a community-based rehabilitation center in Baltimore City. DPSES has had a relationship with them to provide at least 30 beds for returning men to have transitional housing, as well as some programming for reentry. The pandemic obviously caused the department to have to pause that program, but when the pandemic ended, that program was not restarted. The actual spending is shown in Exhibit 16 compared to their appropriations for this. Fiscal 2024 still receives some money, but in 2025, that appropriation is ended. Another aspect of programming is that there was an issue with a Public Information Act request that DPSCS did not respond to in violation of the law. And when that data was released, it showed that the local reentry agreements with counties were not being utilized as much as they possibly could be, or perhaps as they were expected to be used. That program is voluntary, and the locals do not have to take on every offender that is recommended for that program, but it is meant to provide a localized reentry experience so that people have closer contact to those that they're going to be returning to. The third part of this issue is in the correctional programming participation data that was requested in the previous year's Joint Chairman's Report. This data is summarized in Exhibit 17 on page 31. The committees last year requested that this be provided because one of the audits performed by the Maryland Commission on Correctional Standards found that there were very few individuals in the in the work release program at the Maryland Correctional Institution for Women, and there was the need to have more participation data being shared regularly. This shows that institutional programming, particularly for sanitation and dietary programs, far outweigh the other programs that the department offers. There are about one in 5 individuals in educational or vocational programming as a primary assignment, and there is a wait list for education programming of 433 individuals. I will note that this only shows primary assignment, so some individuals would be expected to have a secondary assignment or a tertiary assignment in some of these programs, and that data is not being shown. This also does not show non-participants. So DLS is asking DPSCS to comment on their efforts to enhance transitional housing, opportunities, local reentry placements, and other rehabilitative reentry programming for its many returning citizens. DLS is also recommending a committee narrative requesting a report on, or requesting that the annual data on programming participants and non-participants be included in its MFR submission, and for technical purposes that will also appear in the administration analysis. Finally, there is an update on the Justice Reinvestment Act savings and cost avoidance, but you can look at that on your own time. There's also an appendix on JCR reports that were submitted last year, but I will yield my time, and I appreciate the time.
Thank you very much, Jacob. Any questions from the members as of this time? We appreciate your thorough overview, and with that, we invite the Secretary and her team for their panel. You can begin when you're ready. Also want to welcome Secretary Helene Grady. I see you there in the audience. Good to see you. Secretary Scruggs.
Chair Lewis, members of the committee. For the record, my name is Carolyn J. Scruggs, and I'm the Secretary of the Maryland Department of Public Safety and Correctional Services. With me, I have Naja Roberts, our Chief Financial Officer, Annie Harvey, Deputy Secretary of Operations, and Mr. Joseph Sadal, Deputy Secretary of Administration. The department appreciates the collaboration with the Department of Legislative Services and Mr. Cash's hard work on this analysis. As a 29-year employee of the department, I'm honored to be here today, testifying not just on the budget, but on behalf of the dedicated and hardworking professionals who come to work every day and uphold our mission of protecting the public, its employees, and detainees and offenders under its supervision. I do want to first address something, Chair Lewis, that you questioned when you in your opening statement about the Women's Pre-Release Center. The Women's Pre-Release is still in program review with DGS and DBM, and once it is approved, then we'll be able to move to the design services consulting that we need to do. We're hoping that that will be completed during this fiscal year. In the analysis, the Department of Legislative Services asked the department to respond to 2 issues and 2 recommended actions. The first issue we were asked to comment on are the hiring goals for fiscal years 2024 and 2025, and how we plan to minimize and eliminate the need for mandatory overtime in the future. The Department of Public Safety and Correctional Services recognizes the impact of vacancies on overtime expenditure. I'm pleased to tell you that the department was able to reduce its vacancy from 15.41% in January to 2023 to the present rate as of yesterday of 10.46%, equaling a 32% drop. In calendar year 2023, the department made considerable progress towards filling vacancies and hired 945 new employees. Also, during this past year, the department continues its efforts with several strategic recruitment initiatives in order to attract more qualified applicants and streamline the hiring process. The implementation of same-day hiring events has given us much success. Holding these events in local communities provide easy access to interested applicants. During the hiring events, qualified applicants receive conditional offers and are able to initiate their background checks and complete fingerprinting right on the spot. Hiring managers on site allow attendees to apply for jobs aligning with their special skills and interests. By conducting interviews and preliminary screenings on the spot, the department is able to provide conditional job offers suitable for those candidates immediately. This approach not only reduces the time to hire, but also improves the candidate's experience by offering a quick and decisive hiring process. The results in the reduction in time to hire resulted in a decrease of 13%. During 2023, the department participated in 191 recruitment and outreach events across Maryland and neighboring states, including going into neighborhoods, meeting people, and working with local leaders where they are, bringing the wonderful job opportunities of our department, that our department has to offer to the individuals we both serve and protect, significantly broadening the applicant pool with over 25,000 applications received, of which 3,898 were correctional officers. Other efforts, including partnering with National Night Out events to enhance recruitment in communities, occurred. We continue to simplify recruitment and hiring in order to decrease the likelihood of applicants withdrawing from the process. These simplifications have created a considerable reduction in the overall hiring timeline. This optimization not only saves time, but also enhances the candidate's experience, making the hiring process more efficient and applicant-friendly. The department continues its efforts to better target job marketing and advertising. The department entered into a memorandum of understanding with the Maryland State Ad Agency. This expands our capacity to reach a diverse workforce using multimedia platforms such as radio, television, billboards, and printed advertising. The department also makes use of technology and social media platforms to drive interested applicants directly to the job application portal. One way to do this was by the use of QR codes. I am pleased to report the department experienced an increase in recruitment for all positions: administration, community supervision, and correctional officers within the last year. As you are aware, correctional agencies across the country are facing unprecedented staffing shortages, forcing departments to implement several initiatives to improve hiring and increase retention. Increased salaries, hiring bonuses, and other compensatory allowances have helped correctional hiring. In 2023, the department hired 364 new correctional officers, a 13% increase from the last year. New correctional officers receive a bonus after graduating from the academy and another bonus after satisfactory completion of a one-year probationary period. In addition, the department offers a regional bonus for correctional officers hard to hire at facilities located in areas such as Somerset, Washington, and Allegheny counties. I believe the department retention is as vital as recruitment for the department. Retaining staff avoids the significant costs associated with hiring and training again. As we move through fiscal year 24 into 25, the department will use separation data and exit interviews to gain better insight into employees' departure. By analyzing this data, the department can identify trends and issues with the workforce, leading to more informed and effective retention efforts. The availability of hiring incentives has assisted with recruitment for the past several years, and the Retention Longevity Pay Initiative helps stem the flow of correctional officers in our department. As originally implemented, RLPI was specific to correctional officers. However, the incentive has expanded to other classifications such as dietary, correctional maintenance, and Maryland Correctional Enterprise officers, as well as parole and probation agents. This continues to improve morale and retention of those critical positions. I have also been asked to comment on efforts to enhance transitional housing opportunities, local reentry placements, and other reentry programming for the department's many returning citizens. The department's philosophy is that planning for an offender's reentry begins upon the individual's entry into a pretrial or DOC facility. Reentry calls for a comprehensive systems approach to managing offenders returning to the community. The reentry process includes assessments, case planning, evidence-based programming, and treatment delivery while in custody and under supervision. It is designated to ensure a smooth transition from incarceration to community. The department's reentry programs focus on employment, education, transitional housing, substance abuse treatment, mental health, family reunification, mediation, and so much more. Upon intake, we begin engaging with community and faith-based services to ensure a smooth transition for our returning citizens. The department participates in quarterly reentry resource fairs. These fairs create an opportunity for community organizations to participate in our reentry programs to build a rapport and relationship with the incarcerated individuals before they are released. In addition, over 1,000 incarcerated men and women participate in our own Maryland Correctional Enterprises structured program, of which 20% are hired upon release, further establishing a pipeline to state service. MCE offers a variety of programming, including a 400-hour meat-cutting apprenticeship program that can translate to well-paid jobs in the community. Hundreds of MCE graduates have found employment as meat cutters at places like Whole Foods, BJ's, and Safeway. One of our MCE programs at our women's facility educates females on computer-assisted design that designs office modular units. Most recently, they designed new offices for the Office of the Comptroller. In all, MCE structural training programs include 26 shops throughout 11 DOC facilities. The department has engaged with the local detention centers to expand reentry services for individuals returning to local communities. Currently, out of 23 counties, 10 local reentry agreements exist with county detention centers. These include Allegheny, Anne Arundel, Charles, Dorchester, Howard, Kent, Montgomery, Prince George's, Talbot, and Washington County. This is a voluntary program that may at times provide fewer options for programs and employment, thus leading to the incarcerated person requesting to remain in the Division of Corrections. The department continues to work with local detention center reentry staff to learn what services and opportunities are available to the incarcerated individual should they agree to transfer to the local reentry program. It is important to remember incarcerated individuals and the facilities will return to our communities. A key component of the department is to support the governor's initiative to leave no one behind, reduce child poverty, and build the family structure by changing the trajectory of the incarcerated individual in the eyes of the community. The Department of Legislative Services analysis has asked the department to respond to 2 recommended actions. The first action requires the department to submit a report when an award is made for either health care or mental health care contract that describes the context of the decision. The department accepts this recommendation and will provide all publicly available information on the contract award. The second DLS recommendation requests that the department report its annual data on programming participants and non-participants in the annual MFR submission to DBM and DLS. The department accepts this recommendation and will provide additional feedback within the administration budget response on the suitability of proposed measures based on 2023 JCR and current data development. In conclusion, I am very proud of the women and men in the department, the dedicated team of managers we have, as well as all the individuals who collaborate with us despite of adversity. And we're happy to have any questions.
Thank you, Madam Secretary, for your thorough and comprehensive response and for having your team here. Any questions from the members? All right, seeing none, I wanted to know if you could walk us through, well, the first, I had a couple brief questions. The first was on the contractual services part of the budget. I saw that there's $116 million there. I'm just wondering what generally falls into that category?
Nice.
Direct me to the page that you're speaking about, sir.
Yeah, page 9 it just says contractual services, $116.4 million. So I was just wondering generally what is included in that.
Okay. So that is every contractual service outside of inmate medical. So that would be contractual maintenance services, like if we had to call a contractor in to perform services within the facility. That's what those types of contracts are.
Would education also be in there?
Education is in there as well.
Okay. I remember in the past we've talked about, the use of tablets and other things like that and subscriptions on there. Would that also be included in there?
It is included in there, yes.
What are some of the type of subscription services that we're using for that type of like remote education for folks? Because I know Goucher provides like some in-person classes at MCIW and over at Jessup, but I know that the department started using these tablets to make sure we have educational opportunities for folks who may be in far-reaching facilities. I guess what are we using on those, I guess, to provide the education? Yeah. Okay.
Just reviewed with the University of Maryland system. It is with their legal right now that will allow us to bring all 12 University of Maryland universities into our community. And we will be able to then look at being able to put those types of services, that class, online through those tablets. It is actually with the University of Maryland legal system right now. We hope to have it signed in the next couple of weeks, and then we can start transitioning that education proportion because we are now supported by the new reinstatement of federal Pell.
Mm-hmm. Which is really good to hear, and that's exactly where I was going. Obviously, our entire system had to move online. Some were ahead of others, like UMGC, and to agree that those in the care of the state could have access to, this high-quality programming that our university system is putting out, I think is a good sign for all of us, particularly with reentry in mind. The other question I had was, of course, as related to the healthcare contract, and we had emailed, sent some letters back and forth on that, and I wanted to know if you could, if you can elaborate a little bit on you can share on the $32.7 million for the legal settlement, like kind of, what was the process there? What kind of broke down there? If you could elaborate for me a little bit.
You want me to?
So you're referring to what was the kind of like rationale into the settlement itself?
Yes.
Okay. There were a number of contract claims that were made throughout the process. I think it was 16 or 17 from the inception of the contract. a number of different issues came up. There was some contention that there was a delay in care provided during the transition of the contract. There were some Medicaid reimbursement concerns, as well as a computational issue related to, I think it was over $35,000, the reimbursement of 50% of that. So ultimately, the conclusion of that settlement negotiation was the $20 million payment and then the rescission of liquidated damages that had been assessed.
And that amount that was paid, was that within the, I forget the phrase that Jacob used, but essentially the full contract, was that paid out of what was allowed for the full contract, or was that a separate thing that we had to pay out? Like, where did that payment come from, I guess is my question.
$20 million payment was paid from funds that I had been encumbering from fiscal year 21 to fiscal year 22 in anticipation of having to pay something.
Okay. And encumbered from this contract that wasn't utilized, or, hopefully my question is making sense, but I know that the total contract, I think, was like $750 million or something like that. I guess what I'm trying to figure out is that settlement amount, was it paid out of what was allocated for the bigger contract?
The payment was made within the contract amounts that we had.
Got it. Okay, so it did come from that contract amount.
To go a little bit further on that, the settlement itself did not have an impact to, I think the term you're looking for is like not to exceed value associated with the contract.
Yes, that's where I was headed.
So the not to exceed value did not change, and we were able to make the payment. But the contract upset limit remains the same.
And then now the contract is extended through June as the RFP is going forward, right?
It's currently extended to March 31st.
Okay. And the amount that we needed to extend it through March past December, which was the original deadline, is all still within that not to exceed amount?
Correct. The not to exceed, the amount that we're spending under the contract from January to March is within that not to exceed.
Okay. The last thing I just want to ask, and this is for the record for anyone's watching, just, the RFP was issued in November. I do appreciate the extension that was allowed for people to participate. I had heard word in my capacity of chair that some who would have been interested in participating could not apply because they were nervous with the holidays of the original deadline being around Christmas, that not being able to pull the team together for a contract like this. And I guess I just wanted to get some feedback for you guys on why it was issued in November, and also moving forward, what will be done to make sure there is ample time for people to either apply, or if there's the anticipation of, let's say, delaying when those RFPs are submitted, how there'll be ample time so that people can know that and therefore would be able to apply if they didn't.
So I can say that for both of the RFPs, the dates have actually closed. We've received proposals, so the closing date has passed at this point, so we're currently in evaluation.
Yes, but the original date I remember for the bigger contract, I think it was about December 26th or 27th, and then that was pushed back to early January, and then I think the January 18th was the second date was pushed back.
I think it was January 19th, but
Yeah.
we did receive some correspondence during the RFP process from prospective vendors asking for additional time, and once we received that, we obliged and did extend. Both of the contracts, I want to say it was 56 and around 48 or 50 days for the total RFP period.
Okay.
So more than double what is legally required for an RFP. I think it's 21 days for an RFP.
Yeah, I understand that, but I also acknowledge an RFP going out between two major holidays could put a lot of constraint on people who would be interested. Essentially coming out along Thanksgiving through Christmas, I think might have, on the front of us wanting to anticipate a little bit more time, just giving the holiday season is really where I'm getting at.
Sir, and I think the department will be cognizant of that. We will look as we move in the future, and we know that we have contracts that are ending. We will work more rapidly to ensure that that process does not interfere with holidays and things where we know where people may be on vacation and can't respond accordingly. So we'll make sure.
Thank you, and I appreciate you guys' due diligence and flexibility there. Any other questions from colleagues? All right, seeing none, thank you guys so much for your time and your patience this afternoon. That concludes our budget hearing.